So everyone, today we've got another fabulous case study for you. This is a volleyball player who has knee pain. So in this video, we're going to take you through the assessment for this patient to allow you to work out what you think is the diagnosis before we explain everything with the key clinical reasoning around it. So if you're ready to learn, let's dive in. Hey everyone, Khalid here. Welcome back to Clinical Physio. Let's start with the subjective history for our patient. So, we have a 22-year-old male who's presenting to our clinic with right anterior knee pain. As we said, this patient is a volleyball player and they've really been noticing that volleyball seems to be part of their symptoms. So, when this young man was in his high school or senior school years, he was playing volleyball once to twice a week. However, now that he started university, everything's a little bit more intense. They've got more training session, they have more matches. And since he started playing with the university team 5 months ago, where he's now playing 4 to 5 days a week, he's noticed that his knee symptoms have become much more irritable over this 5-month period. So when it comes to the match itself, he sometimes finds that his pain is worse at the start of the match, but as he gets into the match, it seems to get a little bit easier, which he's quite puzzled by because he thought it would get worse as the match went on. Otherwise, he seems to be quite comfortable with a lot of the other day-to-day activities involving his knee, such as walking or going up and down the stairs or swimming. And we also notice that he's a fit and healthy individual with no major past medical history and he's not taking any medication for this condition. So next, let's head into the objective examination. So first of all, we had a look at how this patient was moving by looking at their gait, and they were able to comfortably walk up and down with a really nice gait pattern without any particular pain on walking. They also presented with no particular swelling or bruising around their knee, just seems to be very painful on palpation. And the particular point that it was painful is, as you can see in the picture here, is right on the inferior or the distal aspect of their patella. That's where it seemed to be most painful for them. So then we looked at active and passive range of movement of both the hips and the knees, and we found that the patient had full pain-free range of movement in all directions of the hip and the knee, both with end of range flexion and extension, comfortable for the patient, not bringing on their symptoms. When we had a look at other specific, more functional tests, those were the key times that we also brought on the patient's symptoms. And there were two particular tests that we did here. The first was a single leg decline squat. So on one leg, facing the floor at a downward angle, that seems to irritate their symptoms. And also, when we did repeated jumping or hopping on that leg in clinic, it seemed to aggravate their symptoms, both with hopping on the spot, but also trying to do a long distance hop test. How far can you hop forwards? That also seemed to bring on the patient's pain, and they had reduced length and distance on their hop on their affected side compared to the unaffected side. So those are some of the key points from the patient's subjective and objective assessment. Now it's over to you. What do you think is the diagnosis for this particular patient? Pause the video, write down your thoughts, and join us in a second. So everyone, with all of that in mind, let's go through the diagnosis. And for us, this particular patient presented with a lot of the key hallmark signs for a patellar tendinopathy, a tendinopathy of the patellar tendon at the anterior knee between the patella and the tibial tuberosity of the tibia. Let's go through some of the key points as to how we came up with this diagnosis. So first of all, let's look at some of the key subjective signs. First of all, the demographics, the fact that this is a young, male, sporty individual, because this is the demographic, the most common group of patient that is most likely to experience a patellar tendinopathy, because the patellar tendon is loaded with those jumping, explosive movements. And as you can see here, volleyball is a particular activity that does require a lot of those movements, particularly the jumping, particularly for those individuals who are jumping up near the net. And so therefore, because this places high loads through the patellar tendon, it makes sense that it's going to be the younger, sporty individuals who are involved in a lot of those explosive jumping movements that are going to be susceptible to this condition. The other key thing was that this patient has had a clear overload. And when we think about tendinopathies in general, we're always listening for that story of overload. What's been the pattern? What have been the activity levels that have then increased the amount of work that that tendon has had to perform? And this patient was a classic example because over the last 5 months, they've been playing more than double the amount of volleyball that they're used to. So their tendon is used to this much activity, and suddenly in the last month, they've been giving that tendon this much activity to do, and therefore it's no surprise that the tendon has said, actually, this is more than I'm used to. I'm getting a bit angry and annoyed. And therefore, that was one of the other key hallmark signs for this patient that pointed us in the direction of a tendinopathy. Then the other key signs which are typical for a patellar tendinopathy. First of all, this concept of the warm-up response. This is something we do sometimes see in different tendons, particularly the patellar tendon and also the Achilles tendon, where at the start of someone's activity, it's painful, but then their tendon seems to warm up with that activity continuing. And this is what that patient said for us at the start of the volleyball match, it was quite painful, but once the game started and they were playing a little bit more within that game, it seemed to improve their symptoms, which they were surprised about. But actually this can be something that we see in different tendinopathies. Next, the fact that this patient's symptoms was not aggravated by low patellar tendon loads. Things like range of movement, things like walking, things like going up and down the stairs and swimming, not aggravating their symptoms. Once again, this fits the picture where we expect those high, more explosive movements to aggravate patellar tendinopathy. And this is actually where we can differentiate against things like patellofemoral pain, because we expect that those lower load activities, such as going up and down the stairs or even sitting for a long period of time, to aggravate symptoms of patellar tendinopathy. So a key way in which we can differentiate their symptoms. Also, the fact that this patient's symptoms were pain-free on range of movement of the knee. This is another differential point that is common for patellar tendinopathy, but that we don't expect so much with other injuries, and therefore that really helped us rule out other particular conditions. And finally, the hallmark signs of patellar tendinopathy: pain on palpation of the inferior pole of the patella, which is where that tendon originates from. And as we said, reproduction of pain on those special functional tests of jumping and hopping, which are really going to put the loads through that tendon, and therefore no surprise that it's painful. So I know that all of you have been asking for more on rehab for the conditions that we go through in these case studies. And therefore, here's one top tip for me on patellar tendinopathy rehab, which is don't ignore leg extensions. This has been a particular exercise that over the last 10-15 years was previously thought of something that was going to be too irritable for patients, but more recently has really grown in popularity. Studies like that of Malieras et al. Have shown that whether it be isometric leg extensions or even moving up towards more high-level leg extension exercise can be really useful for this condition. So, in the early stages, as per the research, I often give patients 45-second holds of isometric leg extensions where they just have to hold the bar, the weight in position for 45 seconds, which can be really useful for trying to reduce pain levels. But then also, I want to make sure that I'm really loading that tendon through leg extensions in the early stages to get more load and tolerance of load through that tendon. Before, in the latter stages, we can think about the jumping and the hopping, the more explosive movements that might be too painful at the beginning, but once you've rehabbed that tendon, can be a lot easier in the end of stages of rehab. So everyone, I really hope you've enjoyed this case study. If you have, please support us by smashing that like button. And remember, we've got loads more resources on our Instagram account at Clinical Physio. Furthermore, if case studies is your thing, please do check out membership, member.clinicalphysio.com, because as a part of membership, you get access to the Case Study Club. This is a brilliant resource where we go through different conditions with different expert physios, where they give us, like you've seen here, the assessment and the diagnosis of the patient through their clinical reasoning so that you can learn for your practice too. So, my name's Khalid. Thank you so much for watching. See you soon here on Clinical Physio.